Telehealth is a service delivery that offers convenience and better access to healthcare. Research has shown that overall patients are satisfied with their telehealth services. However, some practitioners are not comfortable with how this delivery system has changed the therapeutic relationship. So, what is the research saying? Compared to face to face encounters, telehealth services have shorter duration of visits. Practitioners have also reported that telehealth can be less personal than face to face encounters. During telehealth encounters, practitioners can dominate the interaction, decreasing patient participation. Research has also shown that there is less nonverbal communication, less empathy, utterances, and praise, and less small talk and socialization. Research also shows that there is less ability to explain medical jargon. Let's take a look at the case with Bob and his clinician Pat. Bob is a 78-year-old man with diabetes and hypertension. Pat has 4 goals that she would like to achieve during today's interaction: to determine if Bob is taking his medication, to assess if Bob is modifying his diet, to evaluate if Bob is getting regular exercise, and to determine if Bob understands the consequences of not taking care of his diabetes and hypertension. Let's take a look at this first interaction. This is a face-to-face encounter where Bob has gone to Pat's office in a very traditional service delivery.
Good morning, Bob.
Good morning.
My name's Pat. I'm going to be your practitioner today, okay?
Okay.
How are you doing today?
Oh, pretty good. My back's hurting a little bit.
Okay, okay. I'm going to ask you some further questions and I'm going to be typing some information here just to let you be aware of that. Is that okay?
Okay.
Okay. So tell me a little bit about your back pain. Like, where does it hurt and how long has it been bothering you?
I've had it about 6 years or more. It hurts me right in the middle of my back down here.
Okay.
They tell me I have a pinched nerve.
Has this back pain that you're having impacted your ability to do any of, like, exercise?
I used to be able to walk around the whole mall without stopping 2 times every day.
Okay.
Today it takes me a lot longer to get around, and I have to stop frequently because of the pain in my back. Take a rest.
Okay. Well, I'm really sorry to hear that you're having such a problem with your back pain. I'm happy to hear that you're very motivated and you're trying to do the best you can and be active as possible, because that is important. And it sounds like at least you can get some shopping done while you're moving around, you know, getting around in the malls and such, right?
Yeah, my wife usually gives me a list when she wants something. I have to stop and get it for her, pick it up here and there. I had to do that yesterday.
Okay, all right, and it went okay?
Right, it did.
Okay. Tell me about how your diabetes diet is going. Last time we talked, you actually were doing quite an excellent job with this.
Last time I had my blood sugar test done by the doctor, it was almost normal. It's down to 6.1, my AC1, A1, AC1, no, A1C.
Yeah, very good, very good. Great, it's wonderful to hear. It's good you're keeping track of that. Now, is your diabetes diet going well all the time, most of the time, or sometime?
Most of the time.
Okay, can you do me a favor and define what you mean by most of the time? Like, how often are you having difficulty with your diet in regards to the diet we provided you?
When I'm home, no problem. When I go out socially or with my daughter and her husband, I see the food and it looks so much better for some reason, and I have to overeat.
Okay. Well, I'm pretty sure that we all do that at times, so it sounds honestly that you're doing pretty well with everything at this point in time. All right. Although the signs of diabetes and high blood pressure are almost invisible, it is important to understand that there are certain things, so as far as eating carbohydrates and salt and how they can impact your well-being. Did you happen to read over the information that I provided you?
Yes, I did, found it
Okay.
useful.
Okay. Do you have any questions on any of that information?
Not at this time.
Okay. How about medication refills at this time? Do you need any medication refills?
I just checked my bottles before we came in, and I have to get them within the next week or so.
Okay. Have you had any problems taking any of your medications?
None whatsoever.
Okay, good, good. Well, Bob, it looks like you're doing an excellent job, in managing your health and everything that you've been doing to this point in time.
Thank you.
Okay. I see that it looks like there's a diabetes support group that's in your neighborhood, which, again, these support groups can be very informative to help manage your health and meeting other people and how they are doing. It might be useful for you. Would you be interested?
Yes, I would.
Okay. Very good. All right, so the receptionist is going to give you that information when you check out. Do you have any other questions for me at this time?
Not at this time.
Okay. All right, so we're going to see you again in 3 months. If you need anything, please call the office, and I hope you enjoy the beautiful sunshine, okay? Have a great day, Bob. Bye-bye.
Before moving on to see the differences in our telehealth encounter, let's consider what therapeutic mode we saw Pat using. So consider the 6 therapeutic modes of advocating, collaborating, empathizing, encouraging, instructing, and problem solving. What mode did we see Pat using the most? You could make a case for instructing and collaborating. However, the one that we saw the most with Pat is encouraging. Let's take a look at a telehealth encounter with the same goals.
Hello, Bob. Can you hear and see me okay?
Yes.
Bob, you need to unmute yourself because I cannot hear you. Look at the button in the top right-hand corner, and it looks like a microphone. Please hit that.
Can you hear me now?
That is much better. Yes, I can hear you now. My name is Pat, and I'm going to be your practitioner today. I'm just going to ask you some questions, okay?
Okay.
All right. Let's talk about how your diet's going. Are you able to follow the diet that I gave you?
Most of the time, but I do cheat once in a while.
Okay, so tell me, what do you mean by most of the time?
Well, when I'm home, no problem. When I go out, at the social events and that, I tend to eat too much.
Okay, that's fine as long as you're testing your blood glucose levels after you eat foods that are not good for you. Now, let's see how your levels have been. Checking your levels here. I can see from your records that your blood sugar is much more consistent. How much exercise are you getting?
I try to get out and walk around the mall a couple times every 4 or 5 days.
Okay, keep up the good work. Do you need any medication refills at this time?
I just check my bottles, and I see I have to get some refills in the next couple of days.
Okay, so you must be taking the medication regularly. That's great news. Did you get a chance to look at the information that I had given you regarding how diabetes mellitus and hypertension impacts your health?
Yes.
do you have any other questions? If you don't have any other questions, I'll let you go.
None at this time.
Okay. Okay, we'll see you in a few weeks. Keep up the excellent work. Okay, Bob?
Okay.
What were some of the differences that we saw between the telehealth and the face-to-face interaction? Pat was able to accomplish all of her goals in both scenarios. She was professional, polite, and personable in both. However, some key differences should be noted. The research has demonstrated that telehealth encounters are significantly shorter in duration than face-to-face interactions. Let's look and see how long our interactions were. Our face-to-face encounter was 4.91 minutes, and the telehealth encounter was 1.8 minutes. There was a significant difference between the two services. Physicians and practitioners also reported in the literature that they felt the encounters were less personal. As we saw in our interaction, Bob had a little difficulty with the technology during the telehealth encounter, which made the greeting much less personal. This is one example of how our telehealth encounter was less personal. The literature also cites that telehealth encounters tend to be more practitioner dominated than face to face. In our face to face encounter, Bob and Pat both had equal participation in the interaction. Our telehealth encounter was very different. In this interaction, Pat seemed to dominate the conversation and the direction that the visit went. Other variations that were found in the research is that telehealth encounters have less social conversation and praise utterances. Let's see how our interactions went. In our face to face interaction, there were two instances of social conversation, while in telehealth encounter, there were none. As far as praise, during the face to face encounter, there were six instances, while in the telehealth encounter, there were two instances. As we have already mentioned, patients are generally satisfied with their telehealth services. I hope that the case of Bob and Pat has illustrated some of the differences that changed the therapeutic relationship. This is the first step to acknowledging and understanding the differences so that you, as a practitioner, can be more comfortable with providing both face to face and telehealth while developing and maintaining a good therapeutic relationship.